Medicare's brand new GLP-1 Bridge program is officially live nationwide today, completely bypassing standard Part D restrictions to cover major weight loss drugs by Medicare for flat $50 copayment. But the eligibility rules are razor thin. If your doctor's electronic medical chart lacks the precision of diagnostic billing codes about your body mass index tier, the central processing system will issue an instant automatic denial. I am Dr. Kulmeet Kanlas and I'm a board certified physician, and I think this video is the master guide which will help you to navigate Medicare's new GLP Bridge program. You will learn what Medicare's GLP-1 Bridge program is, what are the weight loss drugs which are covered, whether Wegovy is covered, how much Zepbound will cost you, whether your $50 copayment will count towards total Medicare out-of-pocket expenses, whether medical will cover secondary weight loss drugs, and what is your eligibility criteria for this program. This program is Medicare's Innovation Fund, and this program is Medicare's real attempt to control obesity epidemic. And I believe first time the lawmakers have gone out of proportion to help us and make this medication available to general public, which has been banned. In 2003, when we had a fen crisis, Medicare and the Congress unilaterally decided that no more medications which are intended for weight loss will be covered. Since then, the dynamics has changed, the landscape of obesity has changed, and we have very important and safe medication. So now, under Innovation Fund, which was created against the Innovation Fund, which was created to do this kind of experiments, have been implemented. This program will go in effect July 1st, 2026, and it will end on December 31st, 27. So it is not a long-term program, it is a short-term experiment. I want to make sure that everybody knows who is eligible and you use this program wisely, because this program is big enough, if not used properly, can really bankrupt us. We are going to divide our discussion in 7 chapters. The first is the wake-up call. Today, pick up any newspaper or news headlines, you will know about Medicare GLP-1 program. If you are in 25 to 40 years, you may have to navigate your mom and dad's this essential drug. Yes, it is covered for $50, but it is not as simple as the headlines will tell you. There are a lot of nuances which we must cover. I have been tracking this information for quite some time. The bridge, yes, we need to make this bridge. Medicare has traditionally not covered any medication for weight loss since 2003, and that has led to a lot of problems. Now, under this Innovation Fund, Medicare is actually experimenting, and they are trusting us to be prudent steward of taxpayers' money and use this money properly to change our lifestyle and also to help our citizens to lose weight and prevent chronic complications. This program is only a demonstration fund only for 18 months with the razor thin guidelines. Your GLP-1 agonists are covered for 3 most common indications like diabetes, sleep apnea, and MASH or fatty liver already. If you have any of those 3 diagnoses, your Part D programs, whether you have plain Medicare or you have Medicare, they will be covered under those programs. And if you have established diagnosis of these 3 drugs, diabetes, sleep apnea, and MASH or fatty liver, you are not covered under this bridge program. Humana is the central processor. The Humana already has a long record of administering Part D program for many health plans, and they are already doing for 800 different Part D plans. Government has chosen them to handle the prior authorization, claims adjudication, and payment to the pharmacies. Your involvement is zero. This is a game or a problem which needs to be understood properly. Those three indications where the guidelines are very clear, your Part D program will cover it. But now, for weight loss, this will be covered outside Part D program. This was processed under Section 42, which was bypassed by Congress to launch this. There are a lot of misconceptions for this program, and we must clarify that. The scale of the problem. Last year and last 4 or 5 years, look at the amount of money which Part D program, like standard your insurance if you have Medicare, has paid only for this class of drug, $27.5 billion. And 41% of seniors have obesity, meaning they qualify for this medications. And under this program, because it has a very limited funds, about 3.4 million seniors will qualify, because this program will run out of money if they go above that. What that means is they will be looking at physician documentation so precisely, and your physician office has to be laser focused when they create your documents. And I want to educate you also in this process, so that when you ask for these prescriptions, you help your provider to make sure they document it properly and they help you. CMS is running this controlled program for only 18 months. Their goal here is that in 18 months you will lose between 15 to 20% of your body weight, and that hopefully translates into significant loss of chronic medical problems which are associated with obesity, which includes diabetes, hypertension, high cholesterol, sleep apnea, fatty liver, osteoarthritis, joint replacement, hospitalization, falls, name anything, it falls into that part. The drugs, we all need to understand which drugs are covered under this program. There are 3 medications which will be given to you under this program, and you all are very familiar with this name. Wegovy, that is Semaglutide. We all know Ozempic, and Ozempic comes in the form of injections, and Wegovy is their same molecule, but it is sold for indication of obesity. It comes in 2 forms, both tablet and injections. Next is Zepbound, that is your Mounjaro, which will be covered in the form of injections. This is a little complicated process. If you get Wegovy, you will get individual injections the way they are coming before. This one also is a quick pen and not the individual in syringes way you are used to get with. This is a significant hassle in my opinion. And next is Fundeo, which is technically which is the molecule both in Zepbound and Fundeo. So you have a choice of 3 medications: Wegovy, Zepbound, Fundeo. The medications which are used for the indications which are mentioned, obesity, other indication, diabetes, sleep apnea, and MASH or fatty liver, those are sold under the name of Ozempic, Mounjaro. They will not be covered under this program. Zepbound versus Wegovy. I have gotten a lot of questions on this topic in last 1 week, and I just want you to make you understand. The compound in Zepbound is Tirzepatide, which is so it blocks GLP-1 and G. In studies, there has been definitely increased weight loss with versus Wegovy, but the way the formulation under this program is being dispensed, they have made it very complicated. I still cannot find their logic, but I'm pretty sure there is money involved in. And this one was from Surmount trial. If somebody wants to read it, like the difference between weight loss from Zepbound and Wegovy. Who qualifies? It is entirely a weight loss program, and there are 3 tiers. Tier 1, if your body mass index is 35. This is a calculation which is driven from your height and weight. You are not asked any question, because if your body mass index is more than 35, you are bound to get multiple complications. No question is asked. In the description of this video, I will link a online calculator where you plug your weight and height and you will know your body mass index. Second tier is your body mass index if you between 30 to 34.9. This is a tier where you need to have other comorbid conditions, meaning if you have a high blood pressure, which most of the obese people in this category will have and is uncontrolled, and from blood pressure and obesity, if you have kidney disease stage 3 and up, A and up, meaning your GFR is less than 60. And then if your doctor has told you that your heart muscle is getting thick, meaning preserved ejection fraction, and you are in heart failure. Third tier is between 27 to 29. Those are the people if they have prediabetes, meaning if your hemoglobin A1C is between 5.7 to 6.4, if your fasting blood sugar occasionally runs more than bit high and the random blood sugars are high. Plus, if you have already established coronary disease, that you had a stent in your heart, you had a stroke, or you automatically qualifies under tier 3. People who are not qualified is if your body mass index is less than 27. I get lot of questions on this one because everybody has a body image, and we had a very difficult conversation with one of our patients yesterday. She felt that she should be given and her body mass index is 27. I truly believe there is no reason that you should argue with a physician, because we have to stick to the criteria which has been provided to us by the government. Who is excluded? People who already have coverage under Part D program. Those are established diabetes, moderate to severe sleep apnea, and fatty liver. Cost: you will be given this medications for flat $50 co-payment per month. It does not carry month to month. You cannot get this medication more than 30-day prescription at a time. And this does not count toward maximum out-of-pocket. This does not count towards maximum out-of-pocket expenses which every Medicare beneficiary have. In 2020, I think that amount is $2,100. If you get this medication for a whole year, $1 multiplied by 12, that's $600. That will not count towards total out-of-pocket. That clarity needs to be crystal clear, because otherwise you will go through difficult time. It is a flat $50 co-payment per month, does not count towards maximum out-of-pocket, and this $50 does not count. You do not get low-income subsidy help which you get with your Part D medications. So this is $50 flat per month for $50 prescription. And this is the math which I just now did, that for this, if you take the total duration of this program, 50 multiplied by 18, that's $900 maximum out of pocket if you qualify, but that will not count towards your $2,100 program. Prior authorization: your doctor must risk stratify you between 3 BMI-based tiers. Tier 1 more than 35, Tier 2 30 to 34.9, Tier 3 27 to 29. They must have all this information on the prescription. There is a section where they note to the pharmacist. Your doctor must put in the reason for the medication, and it must also say that send it to Bridge program. I've talked to 3 different pharmacy chains. They all recommended that the medication in the notes section, when the prescription goes, it must say send it to Bridge program. it will go, and then you must certify, the doctor must certify that you are doing everything to take care of yourself, meaning you're eating right, you're exercising, you're sleeping well, you're maintaining your relationship, and you are trying to get better, because this is government's attempt to make you healthy. There was a program which was called Balance Program, was supposed to go in effect, which government wanted your insurance to cover it, but the cost to implement that program was too much and your insurance didn't want to bank on you, so buckled out, and that program has been withheld for a long time. I will create a video on Balance Program, because that program will provide you all the evidence-based lifestyle changes you must do. There is a CMS form which your doctor must complete, and it should go to Humana Part D program. Authorization, no enrollment can happen before July 1st, 2026. Today is the day it will start, and this prior auth is valid toward December 31st, 2027. And these are the few criteria which I don't think we need to worry about. There are always some catches which we need to pay attention. This does not count towards total out of pocket. It is only for 18 months. There is no double coverage, meaning you cannot use your regular insurance and this Part D program. And this is a very, very strict program, and it ends at the end of year in 2027. The problem which I see with this program is that 56% of the people stop this medication at the end of 56, and 82% of them regain the same weight where they started. So it is important that you not only need to take this medication, you must work hard to change yourself and change your lifestyle. This is the expected weight loss if you're on Wegovy, about 15%, and if you're Zepbound, they expect that you will lose about 20 to 22% of your weight. You must start doing exercise, especially resistance exercise, so that you don't lose muscle. It is known fact that 45% of weight loss on this drug comes from muscle loss. Muscle is the engine which will keep you afloat. The problem is this program is primarily for the seniors, and they already have low muscle mass, what we call sarcopenia. If they lose more weight, their engine will be weak, and that at the end of the month, we do not want you to be puny old person. Sorry for the analogy, but I do not have better words to say that, because I see this reality every day. I want you to start exercising, resistance exercising, and also high protein diet. But make sure you talk to your doctor, because you may have multiple other comorbidities where high protein diet as a general recommendation may not work for you. So you must get your plan individualized. Future, if government has to continue this program, this will cost $35.5 billion. Do we have this money? I'm pretty sure if we could demonstrate that, if we could change people's habit and they have less of chronic medical problems and the diseases of obesity, and we could prevent inappropriate care. United States spends more than $1 trillion every year in inappropriate care, which taxpayer funds every year. So you must run through Bridge program now. We must start exercising, eating properly, and then the roadmap which our government can adopt. But I don't expect this program getting extended, because I am afraid this medication is going to make our nation more lazier, and they are not going to exercise. If you take this medication and you do not eat right and exercise, you will be left a lot more worse than what you are. $35.5 billion. Wow. I think cost is the real problem. Coverage is only up to 31st. And then what happened was this coverage stopped. Biggest Medicare change ever. I think our lawmakers are making a good effort. My whole intention in this video is just to provide educational resources. Talk to your doctor, and I hope at the end of this program you are much better than before. This is a rapid fire question. Is Medicare GLP-1 bridge program permanent? Absolutely not. It ends on December 27. What are the GLP drugs which are covered? Wegovy, Zepbound, Saxenda. Why is Ozempic not covered under Medicare bridge program? It is covered under the name of Wegovy. Ozempic is covered for diabetes indication. It's the same molecule. What do I need to qualify for Medicare GLP program with comorbidities? Can I get Wegovy through bridge program if already take Ozempic for weight loss? That is a big question. If you have been taking Ozempic or Wegovy before for weight loss, not for diabetes, then you could take it. And your original body mass index will count. Does having sleep apnea mean for Medicare GLP program? Absolutely, this does not make you qualify. That's the one of the criteria that you don't qualify. How does $50 copay work? It is really $50 a month. Yes, it is $50 a month, but it does not count towards your regular copayments. Can I use Medicare prescription payment plan to spread out $50? Absolutely not. $50 per month. How do I sign up for Medicare GLP program? You have to see your doctor. They have to risk stratify you within 3 criteria, 3 tiers, and they will. What does my doctor need to do for prior authorization? Document body mass index and your comorbidities. Does bridge program count towards my Medicare Part D program? No. What does happen after bridge program ends? Coverage stops unless Congress acts, but as I see, I don't see them acting. So you must change yourself. Can I get Zepbound if my doctor prescribe it for sleep apnea? You can get it, but not through bridge program. How much weight can I expect? 13 to 20% on an average. What if I'm already on a GLP through my Part D plan? Can I switch to program? Absolutely, you cannot go change. I hope this was helpful. I will see you in next video. Thank you very much.